So, dear colleagues, welcome to this press conference to have the overview in Quebec about COVID-19. The Premier of Quebec, Mr. François Legault, is together with the Minister of Health and Social Services, Ms. Danielle McCann, as well as the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier. Hello, everyone. I will start with the overview of the last day. We unfortunately have 6 new deaths, a total now of 31. So, of course, I offer my condolences to the families and loved ones of those victims. These are not statistics, these are real people. We now have 4,162 cases that have been confirmed. That is an increase of 732. We have 286 people being hospitalized. That is an increase of 51. And we have 82 people in intensive care, an increase of only 4. So that is the good news of the day. Very few people, keeping in mind the proportions, who are in intensive care. Our great priority right now is really everything that has to do with the medical equipment for protection. I'm talking here about masks in particular, the procedural masks. I'm talking about gloves, the gowns. Every day we have a very detailed overview with the Ministry of Health, the General Secretary of the government, who is also involved. And today, I want to be clear. I want to tell you the truth. For some of the equipment, we have for 3 to 7 days. So it's pretty tight. However, we have orders that should arrive in the next few days. And we have good hopes to be able to get through. So I don't want to worry anybody needlessly, and I also want to take advantage of the opportunity to thank my friend Doug Ford, who accepted this morning to transfer to us certain equipment. So I really appreciate this gesture on the part of the Ontario Premier. I also wish to thank Justin Trudeau, Chrystia Freeland, who are working really hard at securing certain orders from foreign lands through embassies. So thank you very much for your help. I also wish to salute businesses. There are a lot of businesses that have masks, amongst them the Jean Coutu group that has 1.3 million masks. They have accepted transferring them to us. However, I want to repeat the message that I've been giving for a few days to the health care staff. It's very important, if we want to be able to have masks during the entirety of the crisis, it's very important that we use the masks only when it is essential, when it is necessary, that we use them. Danielle is, together with her team, sending guidelines about when to use them, how to use them, but it's more important than ever. And listen, we're no different than anybody else. If you've been listening to news, whether it be in the US or in Europe, everywhere there is a race to get the equipment to protect our people. We are no different from others, and of course we have to be able to have them in what we call the peak, when we get to the peak of the curve. So we're all in the same situation. Today, I'd like to also send a special message to those people who are isolated, the people who are alone. It's normal that you're finding it difficult on a daily basis, and that is why today I'm asking everybody who's not alone, who are lucky enough to be living with somebody, a spouse, a family member, parents, children, please call somebody who's alone today. Give yourself that as a task, as a responsibility. I was telling that to my 2 boys yesterday. Call your grandmother. It's going to make her happy. It's that simple. If everybody calls one person who's alone today, I think that It will make a lot of Quebecers feel good. My daily thanks, I really want to give them to our researchers. We have a lot of researchers right now in Quebec who are working night and day to be able to find medication, vaccines. I'm thinking about Dr. Tardif, amongst others, at the Institute for Cardiology, and I would like to take this opportunity to give out a message in his name. Right now, he needs thousands of participants for his research, for his studies. It takes people who have COVID-19, people who are infected. So we're going to put the coordinates of Dr. Tardif on the government's website, but it could allow this to save lives. So if you have COVID-19 and you accept participating in this very promising research of Dr. Tardif, and I would also like to take this opportunity to thank all the researchers, the men and women who have been working on a lot of different projects and who we hope are going to lead to something fruitful very quickly. And I would like to end with 3 priorities. Don't go out unless it's absolutely necessary. If you do go out, keep 2 meters between you and any other person. And when you come home from your walk or going to the grocery store, you wash your hands with soap for 20 seconds. I think that if we respect that plan, we are going to be saving the lives of Quebecers. So it's worth doing it, and I count on you.
My biggest concern right now is for the medical supplies. Currently, for some equipment, we have only for 3 to 7 days. New shipments should arrive in the next few days, and I want to thank my friend, Premier Doug Ford, who accepted this morning to transfer us some equipment. So thank you very much. I want to thank also Prime Minister Trudeau and Deputy Prime Minister Chrystia Freeland. They are working very hard to secure some orders in other countries. So thank you very much. It's very appreciated, and it's really the top priority right now. Make sure that we'll have enough medical supplies in the next few weeks. And I want to ask again to the health professionals, please use only the supplies when it's necessary. So to get through this fight, we must remain united. Today, I ask Quebecers to give a call to someone who's alone. I know a lot of people are currently suffering from isolation. A phone call can make a big difference for them. We must also continue to follow our 3 priorities. 1, don't go out unless it's necessary. 2, if you do go out, keep your distances. And 3, when you come back home, wash your hands. That's all will save lives. Thank you all.
Merci, Monsieur le Premier Ministre. Alors pour,
Thank you, Mr. Premier. Now for the question period. Mr. Premier, Ms. McCann, Mr. Arruda. There's a movement being drawn right now supported by doctors of the CHUM, amongst others. Dr. Boubez, who is head of orthopedic services at the CHUM and who is suggesting wearing the mask for the population in general. There is a movement starting right now called Masks for All, not to protect themselves from COVID-19, but to avoid transmitting it through particles that could be transported through the air. The Washington Post was saying this morning that the Center for Disease Control in the United States is examining the possibility of suggesting that the population in general wear masks, even masks that are homemade. So, of course, not masks that are supposed to be used by hospitals, N95 or anything like that, but homemade masks. So these are the suggestions by the Hospital de CHUM. First, can you guarantee that wearing a mask by the entire population does not bring any benefits? And secondly, are you discouraging people from using masks? Well, that's an interesting question, and a question that raises a lot of discussions right now. What has to be understood, and we have to look at the context in which we have a shortage right now. Since we have a shortage of masks here as elsewhere, and we haven't had that culture of wearing masks for a long time, so we have to use the masks that we do have for their best use. If we had millions, and also it's important to know, never will a mask measure the basic hygiene measures of washing your hands. I have to tell you that, because if you're wearing a mask and you touch it while you've touched other objects and you feel safe, that can be harmful. But wearing masks can have all sorts of elements, and we are analyzing the studies made on that because we've never experienced that phenomena, and it's different from one society to another. Wearing a mask can increase social distancing because when you are seeing somebody who's wearing a mask, you tend to get away from them because you're wondering, okay, are they ill? And I understand the questions that are being asked. In a perspective, I would say, of the present context where we don't have masks, we have to have a tight management of them. What will we do if we have millions? Well, then we'll see. But right now, we can't do it. So if you have a thick, for example, cloth that can decrease the droplets, probably yes, but not as much as a surgical mask. So I understand the orientation of these questions. And I'm telling you, we're going to study this according to the situation. But I want to tell you, it will never be an alternative to a measure of social distancing, because we have to be able to wear a mask adequately. And even in a situation of procedure, even in a hospital setting, when a surgeon operates, if ever he or she contaminates by touching something, there's a nurse keeping an eye on that person. So can you see? Yes, a mask is an instrument and has to be given to people who have symptoms in a healthcare setting. And yes, it's important when you give care to somebody whom we know to be sick. But is a mask within the community, is that going to be the most crucial element in this fight against the disease? I would say that it might contribute through different effects, not even physical, but psychological effects and others. However, in the present context, we cannot emit that recommendation because we are going to prevent people who are ill and healthcare professionals of a tool that is necessary. But I hope that you understood the nuance, Dr. Arruda, that the CDC is studying in the United States. It's not wearing masks that are for healthcare professionals. The recommendation is to make oneself a mask at home to stop particles from being projected onto other people. If somebody wants to make their own masks out of fabric, I have no problem with that. They can do it. I think that it can be done. But they can't use the mask thinking that that will fix all the problems. They have to have impeccable hand hygiene to go along with that. That's what I'm saying. So we'll look at the recommendation. Would it make people feel safer? If it has an effect on their feeling of protection, why not? But I can't tell you, or rather, all I can tell you is I don't want it to be harmful in the sense that I don't want people to forget the other methods that are more important than wearing a mask. An increase of 732 today, the most important increase so far. You're telling us that we're starting to run out of things. What is the plan B if we run out? Well, obviously, we have to start with using the equipment only for essential needs. That's important because there's big variations from one establishment to another on the use of protective equipment. We are working very hard, a little more for the middle term, to have Quebec businesses, and I'm talking a lot with Doug Ford as well, so that we can work jointly with Ontario companies that could manufacture our material. But we are looking everywhere where we can, and anywhere where we can order things. So I won't keep it from you, and that's why I'm saying so today. It's a concern, but it is the same concern that exists in many states in the United States, for example. Nobody was expecting that we would use as many masks. Another strategy that we have with the N95 mask, because there's two kinds of masks. There's the procedural masks and the N95 mask. And for those, the N95, now we're asking people to disinfect them, so to reuse them. It's being done. Yes, we started doing so. And so we're keeping our merchandise, we're keeping our stock. And that's really important for the N95 because we know that the N95s, we use them only in certain circumstances, but major circumstances when we have procedures on people who are affected by COVID-19 or other people who are infected. In the case of intubations, for example, in the case of surgeries, and other procedures that are very close and invasive kinds of procedures. So we really need those masks. So we've started disinfecting them. For procedural masks, surgical masks that we call, of course, the guideline is really to use them when it is necessary. Public health is clear on that. If somebody's infected, a patient, we put a mask on that person, and the person who gives the care, of course, is going to be wearing a mask. But under other circumstances, when people are not infected, in an everyday setting, people do not need to wear masks. For example, in a CHSLD, in home care, unless people are infected, of course. So we want, in this way, to really protect the quantity of masks that we have, the procedural mask amongst others. And of course, the guidelines are to wash your hands and as much as possible, keep 2 meters between you and another person. If you have to care for somebody and the person is infected, of course you have to wear a mask. So can you tell us about the Ontario delivery, the amount? Well, this is still all being established. We have our first delivery that is supposed to happen today and possibly others in the next few days. Amongst others, procedural masks. Yesterday, Mr. Premier, you invited people who needed to consult psychologists. As you know, however, most of the time you have to pay because in the public network there are very important waiting lists and people have even fewer means to pay psychologists right now. Do you think that you may add resources in the public service or offer free services? And if so, when? Because we have the impression that it's become a critical period about this. Yes, you're right, and we've started already. We know that there are 325,000 people who have a mental health problem who are already known. So that started already. We've asked our interveners to call them all, not just those people, but those who are on the waiting list as well, because there are people who were waiting for services, so they're going to call them all. So that's an important step. And we're also telling the population, if you need services, call your CLSC and we'll get organized to give them, of course, as much as possible over the phone for obvious reasons of social distancing. Of course, if we need to see them, we'll make sure that we can do that. But there are many things that can be done over the phone. And right now, more and more, we are implementing teleconsultation in our network. And so I think that this is going to become with broader scope. And there are also hotlines, helplines. If people want to use them, it's important. But otherwise, if people need psychological services or psychosocial services, call your CLSC, or you will be called if you're already on a waiting list or you already know. Well, let's say that I'm a worker who lost my job. I'm going through distress and I need that kind of help. You're saying that if I call my CLSC, I'll be able to get help quickly right now? Yes, you could have telephone help. And we also are thinking about another strategy that we are working on, where we might have an organization for existing telephone lines to give a broader response to the population, because we know that we're going through difficult and exceptional circumstances as a society, and we probably need answers. As you're saying, somebody who lost their job, who is having anxiety, which is normal. So we're looking at a strategy beyond what I've already told you of people who are known or who are on a waiting list, or to call your CLSC. But a more global strategy for the population of Quebec at large is something that we're working on right now. I would like to be certain that I understood correctly about the protective equipment, because a few days ago you were telling us, let's be careful, let's not waste the material, but you were also telling us that we still had enough for a few weeks. But today you're telling us 3 to 7 days before we get to a shortage. What explains this? Has there been wastage? Had we not evaluated things well? No, I think that a week or two ago I told you a few weeks. Now there's a week left. No, I don't think that in the last few days I did not say a few weeks. But we are in a situation where the orders that we wish to have not all come in. We also have a situation where the usage has increased by quite a bit compared to what had been the previous use. And yet when we look at the number of hospitalizations, it's not necessarily correlated to the increase of the equipment. So that is exactly what we had predicted. 2 weeks ago, we had enough for a few weeks, and now there's enough for 3 to 7 days, and we hope that the orders will be arriving in the next few days. I'd also like to add something, if you'll allow me, Mr. Premier. It has to be said that right now, 10 times more equipment is being used as is regularly used. So what we used to use in 1 year before is being used in 4 weeks, more or less. So it's changed. And you know, we always tell you that things can change very quickly. So that is what changed in the last few days. We realize, of course, because the situation is evolving and that we need to use that equipment more. On another subject concerning the bargaining with the state employees, we learned yesterday the conclusion of an agreement with the FIC concerning the health measures for health and safety to be taken immediately in the context of the pandemic. We understand that there are discussions that are ongoing with other unions about this in the context where the most urgent was settled, which were the short-term safety measures. Is it safe to conclude now that there's going to be a new collective agreement with all the state employees? Would your energies not be better invested to take care of other files, which seems to be pretty heavy? Well, there are discussions that are going to go on in the next few weeks and the next few months. There are employees that there are measures that we're proposing that we wish will be permanent. There are measures that we wish to be temporary. So we're trying to talk about all of these things. So it's not necessarily simple, even for the simple measures that who is it addressed for, what do we do with care attendants, it's not necessarily simple.
Maintenant pour Hugo Pilon-Larose, La Presse.
When you say that for the equipment we have for 3 to 7 days, must we understand that it concerns masks? There are doctors who are asking, the College of Medicine, whether they should, ethically continue treating patients who have COVID-19 if ever we have a shortage of masks. First of all, if they are confronted with this dilemma, the doctors, what should they do? Well, right now, we're not asking anybody, and there's no question of asking anyone to do anything without being protected. We're not there. We're telling you it's tight. We're working really hard on the orders. We're working really hard with Ontario. We're working really hard with the federal government. I have good hopes that we'll be able to get through this. So we are really not at the stage where we're telling people, operate on people without protecting yourself. That's not at all where we are. In terms of mental health offering, Ms. McCann, you're saying that professionals in CLSCs, for example, are going to be able to call people, especially those, or amongst them, people who are on waiting lists. The question that we're asking ourselves is, what is going to stay from all this during the crisis? Why is it that before the crisis, people were on waiting lists and they were suffering, and today it's almost like magical. We can suddenly find people and funds to be able to respond to their needs. After the pandemic is finished, what will remain? Well, I think that's a very good question that you're asking, because I would tell you that at many levels, the network is transforming. When I'm talking to you about teleconsultations, that did not exist, or very, very little in our network. Right now, 30% of specialist doctors in 10 days have implemented their teleconsultation platform. There's 12% in general practitioners in 5 days, so we are continuing doing so, and this is transforming the service offering, and it is going to continue later, of course, afterwards. It's clear we can't do everything over the phone or by teleconsultation, but a lot of things can be done, and people often prefer also not having to go out. And doctors can intervene in this way. In the case of mental health, well, we will be developing teleconsultation platforms as well. So what I'm telling you today is that the quickest and simplest way is the phone. And that's what we're doing. But there's teleconsultation as well that will be developed gradually. And our network, once we leave this crisis, will have been transformed to the benefit of the population. Ms. McCann, I asked you the question a few days ago, or perhaps even over a week ago, concerning the use of makeshift material in hospitals. In a Southern Shore, level 2, they are using masks or protective visors that are made with acetates. Mr. Laforêt, the protection visors, first of all, we have ordered them, and I hope that they will be received soon. We have a certain number of them, but visors can be disinfected. So I will inform myself of what you're telling me, and I'm going to see, because the staff absolutely has to have the material that we give to them and that they have enough, and especially in a level 2, absolutely. A visor can be disinfected, and I'm going to make sure that we have appropriate visors. There's no reason to have makeshift visors in a hospital, any hospital of Quebec. Is it possible right now? And the FIC did raise that there is a distancing or a problem between what you, as a government, you say, and the application being done in the CIUS or hospital centers. The FIC put in line a site that is called I Denounce, because they say that in certain hospitals, the message that you're sending is not what's being done on the premises. Things are progressing, but I understand. And I've spoken to all the union centers yesterday, including the FIC. And I would tell you that what I'm saying now is, not only do we have to flatten the curve, we have to flatten the structure. If you follow what I'm saying, is that we have great organizations, but we have to get closer to the field. We have to have very clear processes about the material, for example, and the protocols. And I believe that, yes, in fact, there can be certain places in Quebec where there are improvements to bring. But I also spoke with the president, the general director, last Friday and yesterday, and I would tell you already that in 3 days there's already been a lot of progress. It has to be known that we are doing things as quickly as possible, at the speed of lightning. In 2 days we do things that would have taken a month last year. But what I'm telling you is I want to be aware, and I understand that the FIC has set up that website, and we have links. Constant, my cabinet chief, speaks to the union every 2 days. So we want to know where there are problems to be able to help, to be able to support our establishments and our teams, so that these processes be optimal to protect our staff. So yes, what we're saying is we want to have news, and I call to have news. I call the president of the FMQ and the FMSQ, and I call the union federations. We want to have news from the field because we want to support our establishments and our teams in a process that is as quickly as possible. The question is for Dr. Arruda. In January or February, when you met us, you were saying that Quebec was ready to face any possibility, that we had nothing to fear. You were, of course, reassuring people. And since the beginning of the crisis, now we see that we might have a shortage, and the health line, was completely overwhelmed. There are people who had to wait for a long time for the results. Are you ready to admit now that we're ready to face a pandemic? Well, listen, it depends on what you mean by were we ready? If you expect that everything is going to go exactly as usual, it's impossible. I don't see a single country in the world that managed that. So perhaps in certain places they had strengths and others had strengths elsewhere. And that's what I said. And I also said that this situation, it's really easy to look at things in hindsight. And it's clear that once we are, through it, we will be looking at things in hindsight. But this situation is changing on a daily basis. So, with the orders that we had placed on everything that we had done, we were ready. But we depend on a lot of international situations as such. I think that Quebec still is, and I'm telling you, the future is going to tell us, history is going to tell us whether we were in fact ready or not, and I'm trying to concentrate on what we have to do in Quebec. But I believe that the best indications or signs of intervention that we've seen so far is generated by literature and the experiences that come from elsewhere, and we're applying them. But yes, we are situations, we are increasing our ability to treat a lot of people, but I'm not God. I cannot give a guarantee. But of course, I think that we really have done the utmost. And for many weeks now, and I'm talking about sectors, other sectors, but where we're working jointly with others, the beds that are available, there's going to be an issue with human resources. That's important as well. The teams are adapting themselves. We are doing training. I consider, that maybe we could do better the next time if we're still here or if I'm still alive, we'll see. And if I'm still occupy this position. But I think that it's really easy right now to say, well, we said this in such and such a date, but I'm telling you, we'll get back to that later. I think that Quebec has done, and I want to say that the people from the health network and from public health, essential workers, society as a whole is doing its utmost, and the government is doing its utmost. I think that if we compare what Quebec has done compared to other governments, we'll see what history will tell us. But I also believe that what is important, you are doing your excellent work of asking questions to challenge us. But now the population also has to get in the game with us. And I believe that we'll do the debriefing of this entire thing later. But I can tell you that I believe that here people are giving their 200, 300%. We have to start thinking about replacing people as well so that they rest a little because, it's hard for people in the population, but it's also very hard for the people who are working. But people are motivated. People believe in the role. There's all sorts of people who want to help us because this is a mission that is very important, protecting others. I think it's also really important to salute the huge work that has been done and continues to be made by the people in the network who are transforming the network entirely to respond to this demand. We have freed up 7,000 beds in 3 weeks, including almost 600 beds in intensive care. That's never been seen before in Quebec, and the efforts are continuing to really make sure that we will have the services for our population. So people are mobilized. Of course, there's always adjustments to be brought, but people are mobilized in the network and at the ministry. I want to add an element. We will have a different Quebec after the pandemic that we're going through right now. Numerically, working from home, our economy is going to be different, is going to transform our society. And we have to rebound on that so that this crisis becomes an opportunity. Would it be possible to have a chart of outbursts for residences for the elderly? How many are affected in Quebec and how many people are infected? How many deaths have there been in those residences and homes? I'm going to try to find my chart because we have all sorts of charts, and I would like to also announce that there will be on websites graphs and data that will be updated much more regularly. There already were in the website quebec.ca, but as of this afternoon, with the collaboration of the Institute and the Ministry of Health and the entire health network, there will be more data. I'm going to try to find the chart. There were over 130, each being at different levels, right? In certain cases, you only have one case and one user, but we are at around 137. But I would propose to you to go have a look at the website This afternoon, the data will be there, or at the very latest tomorrow, because we're still accumulating things. What we wanted to make sure of is to have, stabilized, fair data, just data, before making them public. You saw in the pages of the newspapers this morning, Monsieur Legault, you started preparing the future, relaunching with some of your ministries. What measures are inevitable to give the opportunity to go forward after the crisis for the recovery? Is it lowering the fiscal burden of Quebecers? Are we going to have to put aside the greenhouse gas emissions plan, for example? Well, first, what is important to say is that our priority right now is health. It does not prevent us from having a team that is working on the economic front, because we have two great challenges ahead of us, but it remains that right now, in the short term, the priority is health. We are starting to work with a team on the economy. That means, talking about consumption. So yes, we are going to have to see whether we have to help individuals, so Quebecers have money to be able to start consuming again, and to have the confidence in the future when things start again. Secondly, for businesses, we want them to be ready to start working as soon as we see light at the end of the tunnel, and we can put aside the health problems and concentrate on the economy. So it is important that we identify the businesses that are going to be going through difficulties and make sure that they are ready to be relaunched quickly. And of course, there are things that will have changed. There are sectors where we will have certain people deglobalization, so fewer imports, which presupposes more local production, fewer exports, which means concentrating on new products, new services. Of course, working from home, digitalization, robotics, automation is going to be more important than ever. There are sectors like the delivery sectors that are going to be very important. People are getting used to, right now, of having things delivered to them. The agricultural domain, making sure that we have quality products made here. That's important. And there are really nice opportunities that can be matched with our fight against climate change. For example, all the projects that we have in public transportation, whether it be Montreal, Longueuil, Laval, Quebec, Gatineau, electrical buses in the 20 great cities of Quebec. I think that this will help to quickly add infrastructure. So public contracts that will be replacing private ones that will perhaps not be there right there when we relaunch. So there's a team led by Rick Girard with Pierre Fitzgibbon, Christian Dubé, Jean Boulet as well, to make sure that we be able to do this work together with the unions. I'm thinking about everything that's going to happen in the construction sector. So we're getting ready. But I want to be very clear. My priority when I get up in the morning is health, which does not prevent me from spending a few hours during the day working on the economic plan that we'll need when the time comes. So I have the numbers. Did you want them? And it could change, later when you go to the website, because the data will be updated. But 184 CHSLDs for which there was one case or situation, 114 residences for the elderly, 59 RTF, and in other places where elderly may live, 53. Thank you. So if I could get back to Mr. Premier respectfully. So, on social media, we see all sorts of comments. Sometimes they are unfortunate. But when people look at the makeup of this relaunch committee that you created with 4 ministers, 4 men, they're wondering why, for example, Ms. Guilbeault, who is the deputy premier, is not involved. So I'm giving you the opportunity to answer. Well, listen. You know that we're about half and half at the Council for Ministers. Ms. Guilbeault is going to continue taking care of public safety, but what is important is the economy. So the economy, we're going to have, we'll have experienced important damages. So, of course, that presupposes to have Pierre Fitzgibbon. Of course, we had to finance all of this and to see what the resources are that we have available. Well, that's the Minister of Finance. And anyway, the Minister of Labor, it's important that we have workers that are ready to work safely. So, it's a coincidence, if you will, that it is in fact for men, but right now the priority is health. And it's an excellent woman who is there, Danielle, who's dealing with that. Thank you very much. We will now go to English questions.
You talked to Mr. Arruda about the number of CHSLDs that are affected with outbreaks and also private residences for seniors. How are you working to prevent people basically from dying from seniors' facilities right now?
In fact, and I could say that these numbers can have only one person of the staff, and could be 7%, no one dying. Sometimes it's going to be 5 persons who are going to die. What we do is exactly the measures that we told. We told that those persons, as soon as there is one case, okay, there should be protocols to make sure that we treat people, to make sure that we protect the healthcare workers, to make sure that there is no visitors anymore getting into this because they can get in the community, and it's why we want to apply. And in some places, even if we made those recommendations, even if we made somebody at the door, some people are going by the back door. So that's all those measures that are going to make that we're going to treat. And what is the problem is that there is no treatment, there is no vaccine. And so when you're old, you can go through a way and even get a small disease, but the risk of dying from this is going to be high. And you must understand that in our CHSLDs, it's not people in good conditions. They have different kinds of diseases. They are already at risk for dying from an infection, a normal infection. So it's based on knowing exactly what is the situation. Is it on one floor? Is it only in one unit? And if it's only in one unit, this unit is going to be isolated from the other parts. But we don't want the people again to visit them from outside to get the disease and to transmit it. So that's, I would say, in a search and contain approach. Sometimes there's going to be people dying. It's almost impossible. I cannot promise you there is no perfect thing, because sometimes the virus is already there and you have not been detecting. That's the same thing here in Ontario, everywhere in the world. So it's why we make a lot of emphasis on treating and application of these protocols in those settings.
Mrs. Sonnet, sorry, je voudrais juste, parce que j'ai fait un oubli.
I forgot something very important in the committee. The president from the council, Christian Dubé, Pierre Fitzgibbon, is taking care of the private contracts, but very important, Christian Dubé is taking care of public contracts, and I just want to not forget him.
I have a question for you, Mr. Legault.
Yeah.
If we look at the numbers today, as of today, there are 7,708 confirmed cases in Canada. In Quebec, there is an increase of 732. That's 21.3%. And now we have 4,162 cases. That's 54% of all cases in Canada. The number of cases in Quebec compared to other provinces, is it one of your arguments when you talk to Mr. Ford or any other premiers saying that you need supplies for medical equipment?
No, it's not the argument, because when you look at the figures about the number of people in our hospitals, and when you look at our deaths, we have figures that are quite low. So we have to be careful when you look only at the cases, because first, we tested a lot more. In fact, we are one of the places in the world that tested the most. And we tested also some people that were more at risk. And even right now, we started to consider some people like positive, even without a test, if they are with somebody having been tested positive and have symptoms. So we have a different method, so we have to be careful when we compare. But if you compare our results with United States, with all the countries in Europe, we're doing better so far. So we have to be careful. Yes, it's I'm quite impressed by the results in Ontario regarding the number of cases that are very low. But if we compare with United States and countries in Europe, Quebec is very low. So, and again, we have to repeat that the school break was at the worst time possible, right before we stopped traveling.
Now, question sent by email from Raquel Fletcher, Global News. Are you or Madame Guilbeault talking to the military on a regular basis? Is the military involved in any planning sessions?
No, we don't have right now any need for the army. So all the police has things under control.
Maybe for Dr. Arruda, it could be weeks or even months before we see the other side of that curve. But I'm wondering, Raquel is asking if you can tell us how long it will be before we get back to normal. Will we only be able to loosen these social distancing measures once there's a vaccine?
That's the question, and it's a good question, but I don't think nobody has the answer. It's the question I would like to have, because I would be able to say where things are going to get down. Because we will be only probably able to say that when we're going to be at the top of the thing, based on it's going to be a symmetric curve. Okay, so I think it's impossible. That's I'm sorry, but we will follow it very clearly.
And now, question from CTV News. A question for Minister McCann. There continue to be COVID-19 cases and death in seniors' home in Quebec. Some residences are now isolating their patients on one floor. If patients are asymptomatic, is it the best approach? And how we avoid a situation like we've seen in the seniors' residence in Ontario, where there have been 13 deaths?
Well, I hope I understood your question well, but my understanding and the orientations of public health is when you have symptomatic cases in a long-term facility, you isolate them. So you have what we call a hot zone and a cold zone. The hot zone is where people have symptoms and are being tested for COVID-19 or have been confirmed. And the other zone is the cold zone for the other people. So that is the best way to protect, to separate those two groups of people. I'm not sure if I'm answering the question. Is that okay?
Yeah, I think it's clear. Second question, maybe for Mr. Legault again, for CTV. Commercial and residential rents are due tomorrow, and since many people are now out of work and businesses are closed, will the government delay April rent payments for at least 30 days?
Okay, like I said before, first, all people that need some money will get $2,000 a month from the federal government, retroactive to March 15. There's a problem of cash flow for some people between now or between the April 1st and the time they get their check. So I'm asking owners to be comprehensive, but also we made sure that the Régie du Logement will not accept any eviction during this period.
And our two last questions are from Philippe Autier, Montreal Gazette. First for Mr. Legault. We are getting reports from members of the Jewish community saying they are being denied access to essential services such as pharmacies and banks. There's also racist remarks on social media. What is your reaction to this, and what is your message to Quebecers?
Okay. First, racist messages are unacceptable in Quebec. We will never accept that. And about not getting the right to go to a pharmacy, I'm not aware of that. We may have some restriction in Boisbriand, because of the reason you know. But I don't think that in other places we have this kind of restriction.
And now a question from Phil for Madame McCann. In November, you announced that the new lower parking rates for hospitals will come into effect this spring. We're getting reports that hospitals are still charging the old higher rates. Why is it the case? And also, do you plan to lower rates for patients in hospitals who watch TV in their rooms, for example?
Well, on the first question, the plan was to implement what we had announced for the rates, but that would be in the parking for patients across Quebec. So this was going to be rolled out gradually. I will inquire actually where they're at, but by the end of June, we were supposed to have all the hospitals in Quebec with the new rates that we had announced. For the television in the hospitals, we're analyzing the situation. Maybe some foundations could participate in this effort. We're looking into it right now.
Merci, it's all the time we have.
A clarification, Mr. Legault. Are we saying that there's... Somebody said that they didn't send any medical equipment in Quebec lately. Will we agree that there was equipment that was supposed to be sent? The interpreter did not understand properly.